Welcome to the first episode of the Editor's Podcast for the Journal of Public Health Management and Practice. Today, Dr. Lloyd Novick, Editor-in-Chief, will talk about how the journal came to be and what it has managed to accomplish in its 25 years. The Journal of Public Health Management and Practice has been working to provide research and creative content over the past 25 years. What made you start the journal?
I started the journal because a publisher, not our current publisher, but a previous publisher of Aspen Publication, came to me and he really had an idea for a journal. He had recognized that there was no journal that emphasized practice in public health. And he came to me and he had the idea for the journal that would fill this gap, and even for the title, the Journal of Public Health Management and Practice. And I thought that he made a pretty convincing argument and that we should give this a try.
Since establishing the journal in 1995, of course you've seen many changes in policies, practices, and leadership in public health. What has surprised you the most?
What's been surprising to me is the response to this journal. We have never had a shortage of articles come to us really from the first issue on. There is really a need in the field for a publication such as ours to publish on material that is practical, that is relevant to the work of practitioners in public health. Many of our articles are authored by practitioners or co-authored by practitioners. We also have a lot of academic authorship, but it is all relevant to the practice of public health, to evidence that shows promising approaches in public health. So the biggest surprise is the volume of articles that we receive, the interest of people in having such a publication. So whenever I go to a meeting of practitioners, they know about this journal and they're really appreciative of the role that it fills, bringing information to them that assists their everyday work.
What makes the 25th anniversary issues special?
Well, what's special in the first place is that we've reached the old age of 25. Actually, that's a joke. We're still pretty young at 25, and we're looking forward to the future. And our 25th anniversary issue begins a great year because in the beginning of the issue we have 12 themes that have appeared throughout our publishing history, and these themes are the subject of commentaries written by our editorial board members. So they include a theme on local health department, one on state health department, public health accreditation, public health workforce, public health accreditation, public health preparedness, environmental public health. The list goes on and on. 12 themes in which the Journal of Public Health Management and Practice leads all other publications in the field of public health in presenting relevant material to practitioners and others. We are not about, however, to rest on our laurels. There are other themes that we want to explore and will explore in our next 25 years. Some of those themes, which we're already ramping up, are on opioid addiction, substance abuse problems, violence, including gun violence. So while we have made major strides and that will be reflected in our 25th year, we have a way to go. One of the great advantages of the 25th year of publication is the list of commentaries on the 12 themes, and then readers will be able to go to our website and find a collection of articles on each of those themes on the website.
One of the things that the journal does to encourage collaboration is the supplement program, where there's this focus on the special topic. Could you speak a little bit about the supplement program for the journal?
Yes, by publishing special issues supplement, which are funded entirely by the group that sponsors the supplement, we're able to focus on journal priorities. So some of our supplements, for example, in the coming year, point this out. In January, we'll have a supplement on lead poisoning. In March, we'll have a second supplement on workforce, the Workforce Interest and Needs Survey. Later in the year, we'll have a supplement on Native American epidemiology in Native American tribal centers. In the past, we've had a series of supplements on environmental public health, on public health preparedness, on public health accreditation. So we focus on major issues, and they're all in one volume, in one supplement issue. And again, it makes it easy for our readers to learn the present state of knowledge and practice in those issues.
Thank you so much, Dr. Novick, for touching on the journal and what we've managed to accomplish over the past 25 years. Is there anything else that you wanted to add to the podcast?
I encourage all readers to read our next issue, which is January issue. It actually comes out in December. That's our first issue of our 25th anniversary year. Carries a 25th medallion on the cover, a gold medallion. And it covers those 12 themed commentaries I've talked about in the podcast.
Listeners can access the most current issue of the Journal of Public Health Management and Practice at journals.lww.com/JPHMP. Also, check out the latest feature supplement, which focuses on the impact of public health accreditation.